So as we went through the tumors, I sort of anachronistically referenced a few of these neurocutaneous disorders. So here they are. Emphasis on neuro has to do with the nervous system, and cutaneous, each of these is going to have something to do with the skin. And, if I could have a third feature, as we just saw, a lot of these are going to, have an increased susceptibility of developing particular type of cancer or two. So the ones, without further ado, we have Sturge-Weber, tuberous sclerosis, neurofibromatosis type 1, type 2, and then von Hippel-Lindau. Now, all of these are rare, and yeah, it seems really silly that we should have to talk about these. Maybe full stop period, like that's done. But if I was trying to be generous to like the curriculum, this is 1 in 2,500, this is 1 in 40,000, 1 in 6,000, 1 in 30,000, 1 in 40,000. If you put all of this together, it's really it's a 99.93% chance that you're normal. But that means out of 10,000 people that you will see in the hospital, 7 of these are going to be affected. And I don't know how many, that means like at least once a year, you'll probably see somebody who's affected with one of these diseases. So it's worth like kind of having this in your wheelhouse. So we said nerve, skin, also cancer. All of these are autosomal dominant except for Sturge-Weber. This is a mosaic. And I remember this is like a mosaic is art, and I think of like spiders weaving their webs are like art as well. It's kind of silly. Some of these are also going to cause intellectual disabilities because, well, they have to do with the nervous system and the central nervous system. And yeah, we mentioned this. Sturge-Weber. So I thought it was funny. In Chicago, they have these potholes, and some artist is just filling them with like little mosaics of toilet paper and hand sanitizer. I thought it was kind of funny. So this is somatic mosaicism. So an early mutation during embryogenesis is going to have, proliferate and have trickle down and have downstream effects where lots of these things are going to have mutations. So really early on, it's going to spread. So some of it's in the brain, some of it's in the eye, and some of it's in the skin. And that's really Sturge-Weber syndrome. You could technically have a similar mutation, but it's a little bit later, and it's then not as spread out. It's not as diffuse. So here it might just be localized to the skin. So it's possible we could have this port wine birthmark, one of the symptoms, without having the other features. Anyways, back to this. So GNAC is the gene, and this is, I'm not actually sure about the pathophysiology. It's either stabilizes or destabilizes capillary webs. The idea is that as people grow up as during embryogenesis, they either have too much or too little or too stable or too unstable capillary webs that are abnormal. And so this leads to a point wine stain on the face, just lots of these capillaries. And they can get hemangiomas and angiomas. If you get it of the meninges, this will lead to seizures, can contribute to mental retardation. And if you have it in the sclera, then this can lead to elevated intraocular pressure, which can lead to early onset glaucoma. Here is a picture of a hemangioma, and here's a picture. Tuberous sclerosis, so you're going to get hamartomas in your skin, really. This is just a benign growth of like a mishmash of a bunch of different types of cells. You get these hypomelanotic macules. So these are not raised, these are ash leaf spots. You get pretty much the same thing, hypomelanotic, but now these are thick, they're fibrotic, and they're elevated. That's the Sjogren patch. And this can increase the likelihood of an astrocytoma. And I just think of like tubera, like a tuba, and you need a bunch of muscle to lift a tuba. And so a couple of muscle-related tumors are going to be related to this as well. So it's going to increase the likelihood of developing those. Neurofibromatosis type 1, by far the most common. This is the one you should know the most. Also known as von Recklinghausen syndrome. So this is 17 letters, and this is on the 17th chromosome. So it causes these cutaneous neurofibromas, also hamartomas. We have Schwann cells and mast cells and collagen and axons all kind of bundled together, shown here. And you're going to have these all over the body. And someone's going to have this from birth because all of these are autosomal dominant. And so it's just going to get worse and worse and worse and worse. This might be a little hyperbolic. I don't know. Maybe there's varying expressivity. But yeah, it gets worse over time. You get these café au lait spots, really just the opposite of the ash leaf spot. These are hypermelanotic, not raised though. Lish nodules, so we see these hamartomas all the way over here, but you also can get them on your eyes. So we see them right there, we see them right there, we see them right there, we see them right there. This can, neurofibromatosis also makes you more susceptible to developing optic glioma, and also pheochromocytoma. So look for elevated blood pressure as we're generating too many norepinephrine molecules. Neurofibromatosis type 2 is on chromosome 22. I just think 2 and 2. And you have two ears, and it affects your ears. And you have two eyes, it can give you cataracts. But this gives you a schwannoma. So schwannoma, acoustic neuroma, vestibular schwannoma, tomato. And this can, cause sensory neural hearing loss and cause issues with ataxia, nystagmus, and vertigo as it interacts and compresses the vestibular nerve. It can also contribute to a meningioma. And again, this is the cerebellopontine angle. Von Hippel-Lindau. So okay, we did the hippo with the harp, which is supposed to be the hypoxic susceptible things, the cerebellum and the hippocampus. But then we also saw that there is a hemangioblastoma, is the cerebellum hippo with the, so this is the hippo with the harp, but instead of the hippocampus, it's the Hippel-Lindau. So this is probably silly, but hopefully this helps a little bit. So we have a hippo with the bell, but you might also think of a hippo with a harp. So Hippel hemangioblastoma, we already said it's the cerebellum. And again, why? Because this is really vascular and it's big, so it's likely you'll get a tumor there. Angiomatosis. So this is like a hemangioma that we saw earlier. That's a hemangioma, but there's usually just one. Here you're going to have several of these. I'm sure there's other differences. That's all I know. And then the renal cell carcinoma. So look for somebody who's maybe like peeing blood or something. And then pheochromocytoma. Again, we might have elevated blood pressure. And now all of this works by hypoxia-inducible factor. So normally the von Hippel-Lindau protein, we don't need this HAF, so it gets ubiquinated and it gets destroyed. But if you're in a hypoxic condition, tissue's not getting enough nutrients, not getting enough blood supply, now von Hippel-Lindau lets it live, and it does what it implies, hypoxia inducible. The hypoxic environment induces it to be active, and it's going to help transcribe genes which will promote angiogenesis so that blood vessels can come towards it. We would want that during hypoxia, but we would not want that normally because that is very pro-cancer to have too much angiogenesis. So kind of makes sense then as well that it's associated with the hemangioblastoma as well. So I certainly would know that. And again, cerebellum